Hello, happy Heart Month. I know it's almost the end of the month, but I really wanted to do a video about Heart Month. The month of February, we focus on our heart health, and it's so important because actually lifestyle can have a huge effect on our heart health. A lot of times we think that our genetics determine our overall health in general, and especially our heart health, like hypertension and cardiovascular disease and type 2 diabetes. But actually, lifestyle has a larger factor, believe it or not. So even if you have the gene or you have the history of heart disease in your family, your lifestyle actually can prevent that gene from being turned on. It can actually, you can promote your health with a healthy lifestyle. And what does that mean? So the number one thing we like to talk about with lifestyle is our diet. So focusing on what we consume is what I like to focus on, as opposed to what we should avoid. So focus on consuming an abundance of fruits and vegetables, the rainbow. Eat lots of salads, green leafy vegetables, berries, apples, the variety of fruits and vegetables. Consuming beans and legumes. I like to see where I can add beans to different dishes. So maybe adding it to a soup, substituting beans or lentils for meat in a dish. Other things are whole grains, really important. I know now people are worried about carbohydrate intake, but whole grains are a very important part of your heart health. Whole grains include brown rice, oatmeal, ideally steel cut oats or rolled oats, old fashioned rolled oats, quinoa, farro. There's so many different whole grains that you can consume and add flavor and taste good and are really good for you. And then nuts and seeds. So we should include some of those good nuts and seeds that have those healthy fats that are good for our brain and our blood vessels as well. Great for snacks. Also sprinkling a little flax meal on different dishes and smoothies. Lots of ways you can incorporate those. So what else? Our exercise. So exercising is also really important for our heart health, builds our muscles, including that heart muscle. So moving at least 150 minutes every week. And when we move, we want to get our heart rate up. So it can be walking, dancing, swimming, whatever you like to do, and hopefully you find something that you do like to do. Even if you don't like to do it, you should do it anyway. Sleeping well. Sleep is so important. Fortunately, a lot of times we scrimp on our sleep to do something else, but sleep is vitally important. It's where all of our restorative processes take place. We need to sleep 7 to 9 hours a night. Managing our stress is part of life, but if unchecked stress, so stress that is out of control, is not good. So we need to manage our stress. So that's with mindfulness. You can do breathing techniques, you can exercise, get outside in nature. All of those things will help support your stress. Or talk to somebody also if you find that you're unable to control your stress, you don't have a good coping mechanism for your stress, you should speak with somebody. Healthy relationships. So again, that connection, making sure you're connecting with friends and family in a positive manner, and avoiding risky substances. So all of these lifestyle factors have a huge effect, like I said, on your heart health. It actually can prevent disease, it can reverse disease, and it can treat disease. I hope this was helpful. If so, click follow. And if you want more of this, you can join my mailing list. I send out newsletters periodically. Thank you.